how you originally heard about our office.
Okay, so it was, well, quite a few years ago, and it was at work, and it was through a colleague at work. I was kind of sharing how I had back pain, and so it was Sandy actually, and she had shared with me how she was supposed to have hip surgery, and she went to this chiropractor who was phenomenal, and I should really check it out, and you know, from there I got her the information, and I came here and I started coming in more for lower back issues, because I've always had those like lower back issues just through the years.
Okay.
And then as time went on, I think I had like a previous injury, like a shoulder injury that I was unaware of. You know, I was very active, a lot younger. I played tennis and did different things. At any rate, I was at work one time with, you know, I work with students, and all of a sudden I started to develop like excruciating pain where I couldn't move my right arm. And then it was just really, really painful. I ended up going to a doctor, ended up getting an MRI, and they had asked me, I'll never forget, because it was, even getting the MRI was really painful. And the lady, you know, you could just see in someone's face when they're in pain. And so she said, we're going to make you as comfortable as possible. We're going to get through this. And then, you know, they're not allowed to share information. But what she said to me was, were you ever involved in an accident? And I said, no. And she said, did you have a bad fall? Again, I answered no. So then when I went to the orthopedic surgeon, you know, he had said, we're going to have to do surgery. You have torn tendons or ligaments, right? This was a while back, so I'm trying to remember. And I was in just, the pain was unbearable. And so he had said, we'll give you a shot of lidocaine, I believe. And I was so miserable. I got that shot because that was very painful. And then there's anti-inflammatory medication that he wanted to prescribe, but I have an allergy to that medication, so I couldn't take it. So the pain was still just severe, kind of constant, and I was still coming to Dr. Joe for my lower back. So when I came in, you know, she noticed, and I brought the test results to her, and God bless Dr. Joe. I'm forever grateful for her care, and just really, she went above and beyond. She treated me probably almost every day that she was here, and even on days that she wasn't open, and I won't forget that. And it was aggressive treatment because it was just constant. And it's what made me feel better. Like I remember Tuesdays, the office was closed, and she said, you can come in on Tuesdays, we're just doing paperwork, if you don't mind. You know, at the time her dog Cookie was here, and Lori, and I said, Dr. Joe, I don't care, I just want to feel better. And it was through that of, you know, just coming in regularly, probably four or more times a week. It was remarkable because I was at a point, you know, I'm a mom of 3 boys, and I work full time, so
you need your arms.
I need my arms. So I felt awful because I could do nothing. I couldn't care for myself or my family. I couldn't dress myself. I couldn't pull. I couldn't. My arm was like dangling, and it was through, you know, coming in just about, you know, probably 4 to 5 times a week in the beginning, that I was able to have full range of motion, and that was remarkable. Because one, I'm not, you know, fond of having to have surgeries. I've never have been, so that was like the last resort. And so I said to Dr. Joe, if you could try, you know, this care first, I'm definitely, you know, willing to do this. And I still come.
It's a chiropractic miracle.
It is. And everyone in the office is amazing. I always feel, yeah, everyone's so positive and just so caring. That makes it even, you know, better. The level of care is really phenomenal, and I mean that wholeheartedly. So, and I've brought my family here, and everyone I talk to who has back issues or something similar, they always say, you know, really should try chiropractor. I go to this chiropractor, she's phenomenal.
Thank you so much. We truly thank you for that. Yeah, and you answered the last question actually about like what do you like best about our office, right?
Just everyone's attitude. It's just wonderful. As soon as you walk through the door, it feels
good.
You just feel calm and you feel like you're going to be cared for well, and that's been my experience. So
thank you so much. We love our patients.
Yes, and that comes through.
Thank you so much.
You're very welcome, and I thank you.